If you've been following any of my newsletters that I put out every month, I always make mention of the COVID pandemic because I feel that our club needs to be a source of information, and we all need to stay up to date as Rotarians on just what is going on with the pandemic in our community. And I've asked Dr. Grace Lim to join us this morning to speak about about 10 minutes or so on from her perspective what she is seeing right now and what she is dealing with, and any information that she might have regarding the vaccines coming to our area. So, Grace, I'm going to turn it over to you. You had mentioned to me yesterday that you are the you're the chief doctor for COVID in this area for the private hospitals. Did I get that right?
Yeah, that's correct. Well, I am the leader of the COVID team in the private sector. So I'm the leader of MAC and Unimed because of my specialty. I'm internal medicine with subspecialty of critical care. So practically I'm in charge of the inpatients of San Miguel, but the private sector, not the public.
Got it.
I also have a presentation, Skip, about SOME, a short one. I don't know if you saw it.
I did.
Oh, okay, good. Okay, that's it.
So let's talk a little bit, Grace, about the COVID pandemic, and from your perspective, what are you seeing right now?
Okay, what I'm seeing is that it has, that we had the first wave, everything started here in San Miguel where it was the red light and the lockdown, well, not really lockdown, but where everyone had to isolate on March 15, 2020. So that is almost 1 year. And the thing is that we had cases, it was going up, and then suddenly it went down. But again, the wave, I can't say that it's a second wave because we never left the first wave, We never finished that first wave. But they started to peak again because of Christmas, December. But this Friday in Unimed and MAC and in General Hospital, the cases went down. It also went together because it was the Puente, So in the Puente, there's less admissions. They stay at home or they have a vacation. But I have to say that it's going to peak again. It's going to peak again. And we're having a lot of cases from outside, like hospitalized patients that we have been from Mexico City, Toluca, Pachuca, Irapuato, Celaya, from outside, also from San Miguel, of course, but it's already full. For example, Mexico City, there's no way to get an oxygen. Like if you want to fill in your oxygen at home, there's none. So we get referrals from Mexico City, from MAC that has a big corporation. They have hospitals in Aguascalientes, Irapuato, Mexico City. So we get them referred from there too. And there's a lot, there's no more ages or preferences. I mean, of course, if you have the risk factors for COVID, like diabetes, high blood pressure, old age, but now I have had patients hospitalized of 27 years old, patients of 32 years old, no past medical history. About the cases that have been going on now, it can be young, old, with risk factors or not. So you really have to take care. We got to isolate. This has changed. I don't think there will be a time that it will be safe to just be without the N95 mask or masks. And with the COVID vaccine that you're asking, remember when it was the flu shot that everybody wanted a flu shot and the private sector didn't have it? It was because the public sector was the one in charge of administrating those vaccines. With the COVID, it's going to be the same thing. Right now, the one that has the vaccine is the public healthcare system, not the private. And they just injected, or they gave like the first vaccine to the front line, some nurses, some doctors, but they haven't given the second vaccine. You already saw also that in Atención, there was they published that maybe there's going to be people that will have vaccinations, but if you're not Mexican, then maybe they won't give you the vaccine. We don't know if that is true or not. We really need to wait for the vaccine to come in and for the public healthcare system to say, you know what, we are going to administrate this vaccine, but when they start, because it hasn't arrived for like the normal population.
Do you have any kind of a timetable on when the private sector is going to have access, and you specifically having access to the vaccines that you can administer to your patients?
It has to be first that the vaccine comes in like in the public sector, and then that they accept the private sector to use it. But there's no like limit of time. It happened with the flu shot. With the flu shot, the private sector was waiting for the vaccine in September, and then in October, and then in November, until at the end, it was really the public healthcare system that was in charge. So I don't want to give a date, because what happens is that we still don't have a date from the public healthcare system to see when the private will be in charge. But first, it's the public.
Right, and I understand that even you in the private sector, as a physician, you have not been able to get a vaccine.
No, because I'm in the private sector, so it's only been the public, like General Hospital.
Wow.
They're the ones that have had the first shot. But in Unimed and in MAC, they still do not have the COVID vaccine. So that's what I'm saying. Imagine I'm front line. I'm the leader of the COVID team, and we don't have that. So it will take a while. And also, what I do have to say is that they can say that maybe Americans don't get the vaccine, but it's kind of hard because in this pandemic, it's really all of them. So there can be a possibility that it doesn't matter if you are a foreigner and they will give you the vaccine, like they did it with the flu shot in Kaisis in La Leona.
Right. One of our members, one of our Rotarians wrote that it's from Ron Lennox. He said he saw on the civil information about a Mexican website to register for the vaccine. They're only taking registration for people over the age of 80. So, you know, that's.
We gotta be careful with all of those. I think the best is to really be like in an official website and taking in consideration at the same time what the government says, the national healthcare system here in Mexico or in Guanajuato. That is very important, because I have heard also other groups that are administrating, you know, like the vaccine and also treatments that do not work for COVID. And I mean, everybody is like just trying to, well, get what they can with the COVID, but they are not official. They're not certified. So I think we have to wait. In the moment the vaccine comes and they do it openly to all the population, like they did with the flu shot, that's when we will really, really know.
Yeah, this is the government website right here, Grace, that we're showing on the screen, where people can register.
Oh no, that one is correct. Like that one that it says do the registration for the COVID. Yes, I thought you were talking about like any other website that suddenly said that they're giving it. No. Mm-hmm.
Okay.
No, that one, because that's official.
Okay, yeah, that's a good one then. Okay.
Yes.
But Skip, right now on that website, it says that you can only register if you're working in a hospital that is, for,
right.
If you're, for frontline workers.
That's what Grace had just mentioned.
Okay.
So that's where it is right now.
How come it takes off on the screen?
Grace, have you heard? We're hearing about all these different variants, these mutations of the virus. Britain, South Africa, and I heard that there's a Mexican strain now. That I just heard about this morning.
And before I answer your question, it's not 80 years, it's above 60 years, okay, what the national public healthcare system is saying for you to register. Above 60, not above 80.
All righty. Okay.
That's one. And talking about the strains, there's many strains that are going on. That's why with the vaccine, you won't have like all of the strains, but the most common. Mm-hmm. And so the thing is that if you get COVID of one strain, you can get COVID of another strain. I mean, we already know, and now with this going on since 2019, that you can get, the immunoglobulins like IgG, IgM, that's like a memory response to COVID. but then they take off. They can leave in 3 months and you can get COVID again of the same strain.
Right.
So it doesn't matter. There can be many, many strains, but even though there's a lot, the important thing is that we got to continue the same,
The same
measures,
practices, right?
preventive measures for COVID, correct? And there will be more strains coming on because the virus will, it can change and everything. There will be more strains. It's not only until here.
Let's just hope that the vaccines that are coming out are going to be effective against all of them in one way or another. And so far, at least we're seeing that they are. All right, real quick, because I also am interested in how you guys are doing with So Others May Eat during the pandemic. We checked with you, several months ago. How's that going?
Okay, I'm gonna put could you please put it in the screen?
Yeah, we need to share, Ron, can we share?
Ron has my presentation, right?
Not that I know of.
Uh-oh. Oh, you don't have it there?
Grace, do you have your presentation if we give
Yes.
you co-hosting? Yep.
Yeah, I have it.
I
Okay,
opened
so-
it up. She should be able to share screen.
All
You
right.
should be able to bring it up.
Okay, let me see. I just opened a screen. Let me see. Can you see it there?
No, you have to do your share screen at the bottom.
Oh, sorry. Wait. One moment. Share screen.
There you
Wow.
go.
Okay, there you are.
Okay, is there a way to see like all of you members? Because I only see my own screen.
No, when
You know,
you're sharing, it's difficult.
Yeah,
Okay.
but we can, we can see it. That's fine.
Okay, well, so I'm gonna speak about So Others May Eat. This is our logo, and as you know, all of you, already know about So Others May Eat, but as you know, it started in 1989, and it is a feeding program that is held in the back courtyard right there in La Parroquia, and it feeds poor elderly residents of San Miguel de Allende. It provides a weekly, on Wednesday, nutritional 5-course lunch with live music. This lunch is seated, they have live music, they gather, and there's informational presentations about geriatric health concerns. Here we have a picture of the back courtyard. That's where it is done. And we're seeing here the old folks, as you see, they are, they're elderly folks. Most of them, some don't even have like a place to stay or a home. Like they're really poor, right? But like we say, the first time we got the restrictions due to COVID, it was on March 15, 2020. In 1 month, that will be 1 full year where
Right.
San Miguel, everything had to cancel, everything had to close. And they gave us this notice, the government, to say that we cannot gather because we have around 180 to 200 old folks in the back courtyard every Wednesday. So of course we couldn't do, the lunch. We couldn't have that seated lunch for them. So what we started to do is this, because they don't lend us the back courtyard anymore. We can't use it. It's restricted by the government and with the parish in La Parroquia, that every first Wednesday, before we were giving it every Wednesday, we were giving bags of food at the spa. That's what we would do at first. But then they would gather so much at the spa that the government and Transito were like, you know what, they're gonna fall from the sidewalk, this is gathering, so it was prohibited. So what we did, we spoke with the parish and we said if there was a way for him to lend us one spot or outside of the church or besides, once a month to give despensa and all donations that they want to give. Like if you guys want to give clothes, we also give it every first Wednesday of every month. So here we're seeing volunteers, but the hard part is this. We have here our volunteers. These are regular volunteers, but most of the volunteers are expats. So they are also exposed. So out of the 100% of volunteers that we had, I can say that there's practically less than 10% that would help on giving out, food or these donations. And many of them also, due to COVID, unfortunately, they went back home. Some are not coming back anymore because they're telling me that San Miguel changed drastically. Others left, are waiting for the vaccine, COVID vaccine, and then coming. So we don't have a team like of volunteers. It's not that big, it's not complete, but I mean, we can still do once a month the donations. But if we needed to, for example, like the food and go back again to the lunch in the back and the parroquia's back courtyard, we wouldn't have people that would help. So here we're seeing other volunteers. Maybe you know some of them that are here. We're in the outside part of La Parroquia. And this is what we gave for the first Wednesday of January. So we gave this despensa. There are these boxes that were bought in Aurrera. It has 13 products, 1 coffee, 1 sardines, 2 pasta of, you know, they're called coditos, 2 atole, 2 hot cake, 1 hot cake, spaghetti, tomato sauce, and cooking oil. That's what that box has. We distributed it after Mass, because also in the normal feeding program, they first go to Mass to La Parroquia, and then they go to lunch. So also what we have been working out together, remember in the past, like months ago, I said that we were together with Corazones Unidos, with Red Cross, Patronato por Niños, Feed the Hungry. Where we're working really well is with Feed the Hungry. They are very active and they're doing these bags. Actually, they do 10-kilo bags, but for So Others Made, they did a 5-kilo bag. So these are the bags. It has rice, beans, also cooking oil, some soap, and we put that together and we're distributing them once a month for them to have. Why can't we do it every week? Because it's forbidden. We cannot. We just ask permission to the parish, but if it was for the government, we can't do that. So here we're seeing how they're giving the boxes every first Wednesday of the month. So we're going to give, again, food tomorrow. That would be tomorrow after the Mass of noon. And so that would be around like 1 o'clock. The volunteers will be right there around 12:30 besides the church. And here we're seeing a video. So
Grace, how many volunteers do you have?
well, I mean, right there, there are 10. And so what I want to say is that, I mean, I know that you've seen the video, the tribute to Joe and Antoinette Lim, where you see how the past video that I gave. So of course it's very different, right? I mean, here they're not seated. There's not live music. There was no roll call. There was no medical talk for health concerns. You don't really like speak with the old folks. You just give them the food and, well, the despensa, and then they leave. So it's a big impact. This COVID has been hard, but that's how we keep on helping them. So, because that's the only way we can. We're right now in red light. As you see, it says here from February 1st to February 14, we're going to be in red light, and then they're going to keep on updating the red light. And I do have to say that, yes, we are in red light, because right now it went down, like I say, since Friday, but we started to have admissions again yesterday. in the three hospitals, and Mac, Unimed, and General Hospital. And the thing is that, why is it in red light? Because there's no space. What's going on is that if you got to be hospitalized, there's like a waiting list. It's getting full. People come from outside. And so it's really hard. And unfortunately, we had some old folks that died of COVID. So it's not easy. It's not easy to operate like this soup kitchen until it's really green light. Now, the only hospitals, like I say, that we have here is Unimed, Mac, and the General Hospital. General Hospital, I do not have privileges, but I'm in charge of Mac and Unimed. So if you know any patient that has to be hospitalized, then to avoid, you can just directly call me, because what's going on is that it's very hard. They go to Mac, they go to Unimed, they ask, they see this, they see that. I mean, you can just call me directly if it's an emergency, and I already know how many beds there are, how many beds there isn't. I mean, I'm in charge of the both. So I'm going to give you my cell phone, because also I know you don't have it. I don't have it here in the presentation, but if you have a place to write, my direct personal. Yeah.
We're going to put it in the chat box.
Okay, sure. So in the chat box, it would be 55-2102 4993. So 55-2102 4993. Now, how can I help you in this angle is that there's some people that they bring the patient to Unimed, and then suddenly the patient is there, but there's no beds, so he cannot be assessed, and then he's got to go all the way to another hospital. So before you do that, don't move the patient, just call me.
All right.
In the private sector, of course. And if you want to go to the public, you just go directly to ER.
Anybody have any questions for Dr. Grace? Speak up. All right. Grace, I want to thank you for joining us, especially on short notice too. And boy, I sure hope like heck that things get better. How can people help you?
Well, the truth first, we got to contain, we got to isolate. We got to really take this really seriously, because there's many people that are being affected. And unfortunately, me that I'm in the front line, we're seeing families that are, dying. Like we have the father, the mother, the cousin together with, or full families. So we really have to take care. I mean, that's point number one. Use the mask all the time, all of the preventive measures. That is the first thing you can do to help, and also telling the community to do that, because there is some people that don't even believe in COVID. I mean, you know what's going on, right? That some don't believe, some think that nothing will happen, but no, this is something serious. It can be worse. And also, you can help me like what you're doing, using only the official information to spread out as Rotary Club. That is great. Like, just the official sites. So that way no one gets confused. And, or you can help me is saying that there's COVID, they're not only COVID hospitals, okay? It's COVID and non-COVID. So it's MAC and Unimed. And the first thing is, even if I'm in charge of the hospitals, best is for you to stay at home. It's for you to stay at home. And if you get COVID, it's not for you to run to the hospital. It's for you to stay at home. And only if it really progresses to a pneumonia and it goes to the lungs, and then you can't have good oxygen saturation, then we can do that. I'm also in charge of the evacuation, the air transport for patients, and we've done it also. I have already sent American patients to the States, and so also I'm in charge of that. So if you have a COVID patient that has to be hospitalized, we assess the patient, we stabilize the patient, and then I do the full logistics of also transporting an air ambulance. So if you guys want to go back, I can also do that.
All right, Grace, that is really, really good information. Of course, donations certainly are needed. You can PayPal a donation, and on the screen, you can see the website as well, so others may eat.org. And Grace, we thank you again for joining us this morning. Okay,
Yeah,
good
thank
luck.
you so much.
You bet. Let's stay in touch. All right.
Okay, sure.
Okay, now
bye.
we've got
Skip,
Yeah,
can I ask one more question?
No.
How much of a deposit do you have to give to Unimed in order to get your patient in the door? I mean, we've heard $25,000 or, blank credit cards and that. I
question.
hate to talk about money, but tell me about the money.
Okay. Well, right now, as of today, the way they're doing it, it's a deposit, but it doesn't mean that it's a deposit plus payment. Like that's not like the ticket to go in, but it's for you to continue to pay. So in Unimed, if you're going to go in, it depends on the type of patient, the severity, and what he's going to use. If it's a very mild patient, it can go the deposit from 50,000 to 200,000, but it depends. It depends on the type of patient, and the ones that decide that is the administrative part. If it's a patient that has to be intubated and has to be in the ICU, the deposit has to be $500,000. It has to be 500,000. And in MAC, it's the same. In MAC, if you have to go in the COVID area, the deposit goes from 150,000, around 150,000 to 200, but most of the time it's 150,000. And if the patient is intubated, you got to deposit 400,000. But it's the same. I mean, the costs are very high because we have to use special personal protective equipment. We are in a special area. There's a lot of oxygen consumption. So either way, if you go to Unimed or if you go to MAC, you would have to do those high deposits. But I have to tell you that the patients that we have, most of them, they have insurance. They're not just private patients. And so the insurance absorbs the complete deposit, everything. So that's the patients that we have. They have insurance. Mm-hmm.
Yep, that isn't going to help a lot of us though that don't have health insurance. Some people do, but others don't. Okay, Grace, thank you again for your report, and we're going to move on to club business now.